In this video, I answer your questions about multiple sclerosis. Don't turn away because all of that starts right now. Howdy! Thanks for learning about MS with me, Aaron Boster. I had a blast on a recent Ask Me Anything live stream where I answered your questions about multiple sclerosis. Now, I didn't get to answer every question, so I thought I would do that here. Let's jump in. Sandy asks, what is smoldering MS? Sandy, great question. Smoldering MS is a concept which has been catching on of recent. I give Dr. Gavin Giovannoni a lot of credit for bringing it to the forefront of our thoughts, and it's really a way of reframing our understanding of MS. If we go back into the 90s and early 2000s, many neurologists considered MS to just really be about inflammation, a new attack where someone didn't recover, or a new spot on the MRI. And yes, that is part of MS, but it's not the biggest part. Dr. Gavin Giovannoni talks about MS, smoldering MS, or what he sometimes calls the real MS, to be akin to a shredding machine set on low and slowly shredding your brain in the background. And smoldering MS is one of the drivers of neurological disability. It's a very, very important concept to understand. And many patients experience it, but they don't have words to describe it. How often in clinic have I heard someone say, look, doc, I haven't had an attack. I haven't had any new spots on my MRI, but I'm getting worse. Why? That's explained by this concept of smoldering MS. Our therapies aren't awesome at addressing smoldering MS, and that means that we need to do more, and we are. It has become on the forefront of MS neurologists' minds. It is on the forefront of our development of new therapies, and it's a very honest way of discussing the disease. Sandy, great question. By the way, if you missed the live stream and you want to hear some of the questions that I answered then, I'll throw a card right here so you can check it out. Deborah Bright asks, can you explain being 5 for 5 again? Deborah, I would love to. When I'm helping someone live their best life despite having MS, I want to bring every tool to bear to slow down their disease. And it's my opinion that we want all people with MS to be 5 for 5 in their fight against the disease. These are 5 things that I'm aware of that help slow the disease down. So obviously, I want you to be doing all of them. Number 1 is to not smoke stuff. Smoking stuff speeds up MS by almost 50%. And if you stop smoking, it slows things back down. Now, in reality, there's a much larger conversation behind that about controlling other cardiovascular risk factors, like paying attention to high blood pressure and cholesterol and diabetes, etc. That's number 1. Number 2 is to exercise as part of your lifestyle. Now, that's a very well-crafted sentence because when you do something as part of your lifestyle, you're not rewarded when you do it, and you're not punished when you don't. I, for example, have a lifestyle of showering. I shower almost every morning. Now, I don't tweet out, oh my God, I showered. It's just something that I do. And if I happen to miss a shower in the morning, I'll do it when I get home from work. I need you to exercise in that capacity. It needs to be something integrated into your life. Number 3 is to eat smart and supplement low levels of vitamin D. Vitamin D, it appears, plays a role in slowing down multiple sclerosis. People who have MS with low levels of vitamin D have worsening disease outcomes with more spots on the MRI and more attacks. And so we want to supplement vitamin D. I want to drive the level up above 50 but below 100. How do you do that? Well, one way is to go out in full sun for 15 minutes at a halter top, although in Ohio you might get frostbite. Another way is to eat lots of egg yolks and fatty fish. But the amount of fatty fish that you need to eat is insanely large. And so I recommend that most of my patients take a vitamin D3 pill. How much? That's based on the blood levels. But I will share that most patients do well taking 5,000 international units of D3 every day. Number 4 is mindfulness, the daily practice of centering yourself, being in the now without prejudice. I like to joke that if you're having intercourse and thinking about work, you're not doing it right. You need to be thinking about the event during the event to be mindful. And you can make almost anything mindful. You can have a mindful meal if you turn off the TV and pay attention to what you're eating. smell it, really taste it, and appreciate the people that you get to eat with. I, for example, have turned my shower into a mindful event. My lifestyle is showering. When I'm done with my shower, I sit down in the shower, I close my eyes, and I spend just a few minutes breathing and listening to the water. If you think that sounds weird, I double dog dare you to try it because I find it transformative. Number 5 is to take the most effective disease-modifying therapy that you're comfortable with and make sure that it's working. That's being 5 for 5 in your fight against MS. Are you 5 for 5? Real quick before we go on, would you do me a favor? If you like this video, would you please give it a thumbs up? Also, if you haven't yet subscribed to the channel, please consider doing so. Those 2 actions teach the YouTube algorithm that you like this content and help push it out so more people impacted by MS can benefit. Thank you. Thomas S. writes, I am a young doctor starting in a neurology department that specializes in MS. Could you give me some tips or strategies on how to be a good MS doctor? Well, Thomas, welcome and thank you for this question. A long time ago, a really smart doctor taught me the 3 things that you need to do to be a good doc, and I'm excited to share them with you now. Number 1, assume nothing. All priests have syphilis until proven otherwise. Number 2, trust no one. If you haven't done it, assume it wasn't done correctly. And number 3, read like hell. Thomas, being an MS doctor or being a doctor involves listening, really listening and thinking and asking appropriate questions. Don't assume that you understand what's going on, and take the time to shut up and listen when someone's giving you an answer. The second one about doing your own work is really important. Don't assume the radiologist read the report right. Look at the films yourself. I'd take it a step further and I would show the patient their films and discuss it with them. And number 3 is read like hell. There is a literature in multiple sclerosis. I spend every morning and some evenings reading that literature to keep myself up to date. Thomas, again, welcome to the field of MS, and I look forward to hearing more from you in the future. Now, there's a whole host of questions that I didn't get to, but don't fret. I'll make more videos where I'll answer those questions in the near future. The biggest thing that you could do to help this channel grow is to watch another video. So please click the video that's on your screen right now. And until my next Monday morning vid or my next live stream, this is Boster saying be safe and take care.